You're listening to Through Help and Back. Through Help and Back is a podcast focused on mental health, addiction, treatment, recovery, and all things related to personal improvement and wellness. Don't worry, we're not here to talk about problems without solutions, and we're definitely not here to talk about struggles without success. So come with your problems, leave with our solutions. Welcome back, everybody, to another episode Through Help and Back. So very excited to have you today. It is August 1st when we are filming this. The weather seems to have broken a little bit. We're in some more comfortable temperatures. The skies are clear. We don't have all those Canadian wildfires breathing smoke down us here in New England like we've had. So, summertime and the living's easy. We're breathing easy. The temperature is nice, and we're right in the dog days here, so we're feeling good. Not an easy topic today that we're going to get into. Actually, a very important topic, and in a lot of ways, the most important topic. Most of us that I know of have mothers and come from a mother and know a mother and have some connection to motherhood in that way. And so a lot is expected of our mothers. And then we often have to think about what are we giving to our moms and how are we seeing our moms to be able to support them and make sure that they are good, make sure that they are equipped and have the resources they need. And when mom's happy, everybody's happy. That's kind of the old saying. So luckily, we have an expert with us today. We have a registered psychotherapist from Ontario, Canada. So speaking of those wildfires, we'll talk to her about that and see if she had a hand in that. But Marissa Holway is with us, and she is a specialist in maternal mental health. Something that we don't often think about. We think about, mother's health and maternal care, but when I went through it with my wife and going through the What to Expect When You're Expecting book, there wasn't a big mental health section, and there wasn't a lot given to us at the hospital about what to do and how to take care of mom mentally and how moms can take care of themselves. So, Marissa, very happy to have you, very thankful to have you, and appreciate you making the time for us today.
Yeah, thanks so much for having me. This is great.
Yeah, so we'll get into moms, but I do want to talk about these fires. Like, what is going on with these? Is that a huge story for you up there? Like, we're like seeing the smog and stuff. Like, how is it affecting you guys?
Well, like right now in Ontario, it's okay. It was pretty bad like a little while ago. The air quality was terrible. And so then all of a sudden you're having to like stay indoors and, it just looks like a cloudy day to you. But then when you go out and all you smell is campfire. Yeah, it was pretty impactful for a long time. So I think they're going back and forth to having them under control, and hopefully it kind of starts to resolve so people aren't having to worry about that anymore. It's not what you have to want to worry about.
Okay, it affected my mental health because, it's like we all become junior meteorologists watching the wind patterns, and where I live is a fairly scenic area, lots of mountains and trees and stuff, and I can remember driving around and sort of noticing like I can't see the mountains. I can't see, so you don't really, all that stuff you take for granted, it really changed it over the last month. And I just hope everybody's healthy and take care. A lot of masks. We brought the masks back out, right? We had the air purifiers going, so it was good to dust off the masks from the COVID days. So tell me a little bit about, registered as a psychotherapist in Canada. Tell me a little bit about your work and how long you've been doing that.
So I've been a registered psychotherapist just over 10 years. And it wasn't until about 5 years ago that I started to specialize in perinatal and maternal mental health. It took me having my own kids and having my first child to really show me what I am passionate about and how specific this area of mental health is and why we need to put focus on it there are some different factors that are involved, and especially when you get into symptoms that any person can be dealing with, there's going to be different factors and different considerations when you're thinking about a mom who's either trying to conceive, in pregnancy or early postpartum specifically. But then also when you grow and you have some younger children too, there's just some different things that are happening that when you can really look at the full picture and consider it, it tells you something different that's part of the story than for somebody who may not have children too. And it's something that just as I've dove into it more and learned through my experience with my now 2 kids, and professionally as well, I've been working with other moms. It's really great to kind of increase the community within it and to kind of break down those walls where even if you don't feel like you're going to have trouble reaching out or talking to friends about things, I think having a community and having people that get it, even if they've maybe had a slightly different experience, can really be validating and can make a huge difference to just know that it's not you and you're not necessarily doing anything wrong. It's hard. And that's just the truth. It's just hard.
The find your tribe thing is so key across any issue, right? Like if folks are suffering from depression or anxiety or especially addiction, I think addiction kind of nailed that with the 12-step movement and the groups there. Like just finding like-minded people who understand the challenges from the inside out is so affirming and so healthy. So I think that's a real key thing about what you're saying. When you talked about, once you had your children, your interest grew. So can you, for those who don't have children yet, can you kind of give a sneak peek or kind of a highlight of how, your understanding changed once you were a mom versus what you thought about the process or if you even thought about it at all beforehand? What is it like? And what are these guys, what's waiting for them, for those people who don't have children? What's going to change for them?
Yeah, well, I don't want to scare them. But, there's two camps of people, right? There's the ones that kind of say they want to know everything, right? Because they feel like if you have the knowledge, it can kind of help you in maybe feeling like you have a bit more control, or you can kind of prep yourself. And then I think there's people too that, they either don't want to know or they just kind of feel like, it's going to be different when I go through it. And that's all fine. And that all works. I was kind of like straddling the line of, I am a person that I like to prevent issues before they happen. And so sometimes I look at things kind of from a bit more of a negative space of how do I prep myself. So when we were like planning for our son to come, we did the typical prenatal class and it was good. We learned some stuff from it, but I wouldn't say it was like rocket science. And, most of those classes don't really focus on things like mom and dad's mental health a whole lot. It doesn't talk about really how your relationship's going to change and what you can do to kind of stick on the team together and really work through that. They talk about the basics of your hormones are going to go out of whack, but what that actually means and like what you live can be completely different. And so I had a couple of friends that had kids before me, so I had a small window into it, but then it took me having my son, I realized I wasn't a very good support to them. Like I had no idea what they were going through. I didn't check in on them enough. I didn't ask the questions that would have been helpful because I didn't really know what to do either. And so going through that, we were planning, you were doing the stuff that people say you should do, right? And you're looking at, building the nursery and this list of like things that everybody says you need to have for the baby. And you're not going to use most of it, but you don't know because you're just going off of what everybody else is saying. And then I had my son and we were like, whoa, what happened? Like, this is crazy. So there's the whole labor experience too, which for that, I was ignoring a little bit and I was trying to be naive because I wanted to know what could happen to educate myself on my options, but also the thought was a little scary.
Sure.
So I would look at it and say, okay, well, there's going to be a certain amount of this that I have to just roll with. So if I don't read all the stuff and I don't know all the things, I'm just going to have to roll with it when it happens. And we did that and it was fine, but it probably could have been better. And I probably could have had an easier time with certain things, or I probably wouldn't have felt exactly how I did, like the days and the weeks after too. And so that was like a huge learning experience. And then you enter into that newborn area and, sleep deprivation hits and your hormones are going nuts and you don't feel like a human being. You don't know what is happening. And so going through that, and it wasn't until I was about like 5 or 6 months postpartum where I started to really realize what was happening for me, especially that 1 month afterwards. and going through baby blues and going through postpartum anxiety, like it took me a while to recognize I had that. And so then I really got into, okay, if I live in therapy world and this is my everyday and I don't realize that I was going through this, or it took this long really for me to connect with it and to acknowledge it, of course other people are having trouble with this too. And so I wanted to take my skills and I wanted to put them in a place where I could help other people just through my experience and with my training as well, so that at the very least it could be easier for them.
I've shared on here a little bit about some of my past struggles with anxiety and dealing with that. And I had that exact same, I don't know if you want to call it like doubt or questioning yourself, but it was exactly that. Like I'm working with people all day, every day on this exact issue. Yet here I am on the evenings and weekends, like having a full-blown panic attack, right? And so you get to this kind of like weird questioning place where like, I've got all this training and I've got all of this background and knowledge, and I don't have the genie in the bottle, right? Like I don't have a firm grip on this. So now once you work through it, you end up in that place you exactly talked about, where it's like, well, okay, if I struggled, others are going to be struggling even more without that knowledge and without that background. So it's great to actually apply it and give it to other people that could use the help. What, for those folks who aren't trained, just the regular, mom and dad kind of going through it. Mom, what are some of the common struggles that you do see? I mean, we're talking like hormones out of whack, we're talking sleep deprivation, but you've got all the training and you went through those struggles. What are the folks that you're working with, the people who don't have that background, what are they presenting with and what are they coming in? Like, what are their challenges that you most often see?
So, I mean, like really typical can just be mood fluctuations, right? And like having a difficult time regulating. Because of sleep deprivation and the impact that that can have and the increased stress, like if you're at all predisposed to anxiety, low mood, depression, anything else, that's going to just go right off the Richter scale, right? Like it's really hard to just keep that all intact. I see a lot of like challenges with their relationships with their partners because they are also dealing with things too. You're dealing, especially if you talk about like a first child, you haven't done it before, right? You don't know. There can be a lot of high expectations of why am I having such a hard time with this? Because either we tell ourselves or like society tells us a lot and people close to us of, well, this is natural. You should just know what to do. Well, no, like, have you ever just known how to do something? And then now you're talking about like taking care of and raising a human being to not just keep them alive, but like to help them prosper. And if you're having any sort of challenge, like, of course you're going to. Like, it's crazy to think that you're going to do this perfectly or very well at the very least. So I think those things like come up very often for most people and are very, very normal.
There's some weird societal stuff too, where like you said, I agree with you 100%. There's no way to expect that you would have this down perfectly, especially if you've never done it. I mean, even if you have done it, people with 5, 6 children, there's still struggles, but there's this weird societal thing, I think, where people like kind of expect you to know, like we were kicked out of the hospital like 2 days after birth, like, good luck, you got it from here, right? And I, the stereotypical like kid crying in public and everybody kind of gives mom the side eye, like, what are they doing, right? And especially around moms, it almost feels like there's this pressure to like appear like they have it all together, right? Like if they're fraying at the edges or they're disorganized or they're not dressed properly or their hair is not done, they're supposed to maintain all these things they were maintaining before. And I think there's some like, I don't know if you feel this or if this is, I'm just pulling this out of nowhere, but it almost feels like there's some judgment to it if people show that struggle, right? Like if they are openly like, hey, I don't really have this, I'm trying, but I don't have it down. I don't know. It feels like some of the initial reactions are based around judgment and sort of like what's wrong with that mom versus what can we do to provide support. Are you seeing that as well? Or did you feel that?
Yeah, I think judgment's a huge component, whether it's like judgment towards yourself or like feeling it from others, because absolutely the fear is, I don't know 100% what I'm doing. I'm trying to figure it out. I'm kind of going with what I can. And then if there's any feeling of someone looking at you sideways or, God forbid your kid acts up somewhere, right? Like, because kids need to be perfect or like in line. which is not realistic, you feel you take the responsibility for that. And I think there is like this movement forward of like, let's just show the true authentic sense of it. And like you're not always going to look together. You're going to forget the kids' lunch. Like these things happen. And a lot of people do talk about it like it's normalized. But then you can also swing the other way where it almost becomes this hierarchy of like, okay, well, how unorganized can I look, or can I take like the pride in being like that kind of mom, that kind of parent too? And there's different judgments around that. So it can feel like you can't win. And then when you get stuck in that feeling, that can be really challenging because then you're asking yourself, well, what am I supposed to do? But I like that because then it enters in this space of, okay, so let's forget that noise and let's focus on you. Like what in your parenting structure, in your kind of motherhood journey, like what's important to you and what are you valuing? And if you want to not worry about hair and makeup and like just roll with the punches and that kind of stuff, then do that. And how do we deal with potential judgments coming from other people? And how do you rectify like potential judgments that you're putting on yourself? And where is that coming from? Because then that's opening up the conversation more so of, well, how are you going to step forward with that instead of feeling stuck and actually giving yourself that compassion in that place of, you're not doing this for anybody else, right? Like just bringing it back to a sense of yourself and what's important to you and your partnership, like, your family, what you guys value, instead of having all the onus on the outside noise and chatter that's happening. And that's hard to do because we can't really change other people. All we can really do is like work on ourselves and how we're absorbing it.
I think that is such a key component in all journeys, right? And everybody's lived experience is how much am I doing for other people versus how much am I really doing for myself? And how much of what I'm expressing is an expression of, hey, like me, accept me, love me, please don't judge me. And how much of this is actually an expression of our authentic self and really sharing what's true about our experience, And for moms, I think it's magnified because the stakes are so high, right? Like people's lives, a child's life depends upon this. And then you've got the judgments and they multiply. So I think across the board, one of the commonalities is just a life challenge is getting to a place of living for yourself instead of living for others. Because one, they're probably not thinking about you as much as you think. They may be annoyed because your kid cried on the plane or the bus, but they don't go home and talk about it for the rest of their life, right? They're on to their own stuff. And two, life is just too long and too short to do it for everybody else, right? It's just day in and day out.
That's a whole lot of wasted energy.
Oh, it's just exhausting to even think about it, You had talked about your personal struggles with this. Was yours, kind of to get a little bit more background with you, was it the postpartum issue? Was it more hormonal? Did you have that judgment you struggle with? Like, what were some of the specifics around your particular struggle?
I'd say generally it was probably all of the above. Like I after having my son, I got hit with baby blues pretty hard. And I knew it was a thing. But then when you're going through it and like literally for 2 to 3 weeks, almost every day, like I would just be crying. I would feel the tears going down my face. I didn't really even know what I felt, but I couldn't stop it. And then it was the simplest things. Like it was even something happy. Like I would look at my son sleeping and I would just start bawling like out of nowhere. And I'm like, he's so amazing. I don't want to mess him up, And it was just a really uncomfortable feeling of I am not in charge of my emotions, really. And then I kind of noticed it in the moment, but I would say probably he was about 2 weeks old and I was getting the stroller set. I decided, okay, today's a big day. I'm going to take him for a walk around the block on my own. It was like the first time I was doing that. And I just felt this huge sense of panic. And like my chest was so tight and it continued all day. And I just kept thinking to myself, I'm like, this is ridiculous. I'm putting him in a stroller. We're going to go for 15 minutes. And I was worried. I'm like, what if he needs something? But then I would catch myself and I'd say, okay, if he needs something, I come home. Or like, what is he going to need in 10 minutes? Like, this is going to be fine. And I went for that walk and I felt so uncomfortable and just anxious and like tight chest, had a hard time breathing. I was looking over my shoulder. Like I just felt on edge, like really the whole time. And the next day I did it and it was like slightly better, but it was still pretty bad. And I thought, okay, like this is getting better. I'm doing this because I know I need to do this, but I didn't want to. I wanted to hibernate in my house. And really that isolation is like the worst thing. And there's a difference between like, taking care of yourself and limiting your interactions with other people if it's not going to be helpful. But I knew that's not what I was doing. And so little pieces of that would kind of continue where I just had this generalized feeling of like really like constricting feeling in my chest for probably a couple of months. And I'd be on edge. When I go to the grocery store, I would like worry about, okay, what's the process of getting him in versus the groceries versus taking the cart back? Don't want to leave him. What if somebody jumps in my car? Like all of these what ifs and like terrifying thoughts that realistically not going to happen. The cart disposal is like 2 lanes over, that kind of thing. But you're just going everywhere. And so at about 6 months postpartum, I started to feel better. And then I realized, oh my God, like I was so anxious. And it was manifesting itself in ways where I was really quick to get irritated. I would snap at my husband for not knowing exactly what to do right away, which he wasn't with the baby as much because he had returned to work. So he was just asking me a question of like what I thought would be helpful. And I was so annoyed that he just couldn't handle it himself. And it was like almost this inner anger coming out a lot more and just feeling like I am always on the clock. I am always the person to go to. I'm annoyed by that. But at the same point, I don't feel comfortable releasing responsibility to other people either. And that was a tough battle. And it's still one that I kind of like play with a little bit. But after like having that kind of realization, and then you're looking at yourself of like, okay, well, you got to decide, do you want to be the one in charge and what comes with that? Or are you going to deal with the discomfort of letting other people at least try and giving them opportunities to help, to take over, to give you a break? Because wouldn't that give you something better? And so like a choice had to be made. And I talk about that a lot with different moms at all different stages of what is it that you're doing that's maybe keeping the current story happening, that maybe we're just kind of uncomfortable and having a hard time looking at the possibility of something different, because that means doing something different, which can also be scary.
It's so interesting because the tightness and the anxiety I can obviously connect with, and it just how when you're dealing with, a feeling problem, like I feel anxious, I feel scared, I feel, you can't really use logic to make it go away. It's so funny. I did all that same stuff. Like you're fine. Your blood pressure is good. I even had like monitors I would use, like your heart rate is fine. Like I'd get all this data that said like, no, you're good. But you just don't feel it. You know what I mean? Like I feel this. You're putting all your logic on this side of the table, but the emotional stuff is over here. And that's what's kind of winning the argument right now, So was the big factor for you just time? I mean, how were you able to connect to that emotional side and feel better? Because I hear elements of like, well, do it anyway, right? Like I feel like crap, but I'm going to take the walk because I know I should take the walk. So was it a matter of forcing yourself into action, or what were the keys to getting yourself to feel better and allow that to kind of lessen? I mean, what did you do to make those changes?
Yeah, I think the combination of it was my husband was really good at, he was very sensitive to the situation, but he was pointing out like, listen, I think this is a bit of an issue and you might want to consider finding ways of having some time for yourself. And, the first conversation, that didn't go great, but what he was saying was there's nothing wrong with it at all. And I had to put myself into, I thought of, okay, I've had my time to hibernate. This is not really going anywhere with doing that. And I knew what I'm fighting is kind of what I need to lean into a little bit. So
That's right.
I found very small ways of initiating that at first. And then it got easier. So I would have, my mom would come over My mom was so great. She would check in on, because she knew what it was like, but she would check on me. I think she checked on me almost every single day for the first 3 months. And sometimes those visits were 10 minutes, and sometimes she was here for a few hours. And it was whatever, she just was here, you know? And so it was
Yeah.
just really nice to have that. But then she also said, why not, you know, 1 day a week, you go to yoga and I'll watch the baby. We'll work out the timing with feeding and everything. And sure, the first time I did that and the first couple of times after, I was pretty panicked and you feel like you're racing. So I'm not really like relaxing when I'm at the class, but I was doing it. It wasn't doing it perfectly. It was just like, let's have some messy action here and just try and see if that helps anything, if that changes anything. And so it was implementing those little pieces of how do I actually get some pieces in the day for me where I can actually remove myself and not be the lead person, the lead caregiver, while leaving baby with somebody that I feel comfortable with so I can actually kind of relax too. And then also just looking at, I think with a little bit of time, I started to feel more confident and competent in my ability to be a mom. Of I might not know exactly what he needs. I might not know how to fix his napping issue right now, but I'm learning some things and I'm trying some different things. And I'm recognizing that if it doesn't go perfectly, that doesn't mean I'm doing it wrong. It just means it's not working today. And so being able to embrace that, I think, was pretty big in taking some steps forward of if it doesn't go great, it doesn't mean that you're doing something wrong. And that's okay. So it's taking that internal judgment off too, and just giving myself a little bit of breathing space of, yeah, we're figuring it out. And that's all right.
Well, and the win is in the attempt, right? And that's hard to see at the time. And I love that phrase you used about messy action, right? Like you don't have it down, but try, right? Just do it badly, do it poorly, do it. Let it be a disaster. Like go for the walk and turn around in 2 minutes. You know, who cares? You put action to it. You didn't do it perfectly. You know, you forget the bottle, you forget the pacifier, turn the car around. Oh, well, it wasn't a perfect attempt. But the messy action, I really like that. I hadn't heard that phrase before, but it makes perfect sense because once you try, you've won, and everything else is a bonus beyond that, right? Because it will get easier over time. Yeah.
Yeah, and you got to have a bit of sensitive humor with it too, right? Like, what if I tried to do this so terribly? Like, what if I really, really put my effort into just blowing this up? And you'll probably see that it's still fine. Like, you know, like you're not really going to create a huge issue, and it just takes the pressure off, and it just starts to make you kind of laugh at like the ridiculousness of some of the thoughts and the stories that we like have running on in our background. Of you can get into the deep later, but I think in the moment it's kind of like, okay, what's stopping me? What if I did it anyway? What if it was fine? Like, what is another alternative that maybe isn't the worst case scenario, just to get moving? Because it's always easier, like once you've started, it's just actually taking that first step.
I like the use of paradox there too. Like what's the worst you could do? Like, let's do this really poorly. Like, you know, cause I worked in addictions for a long time and we always put recovery plans together. And like, it's a weird pressure because you're sitting there focused on all the things you need to do differently so that life goes right. And it kind of implies, and it applies this pressure to them of like, here's your plan for perfection. And if you fall short of any of this, it's all going to go bad. Right. So I always like to go like, now let's put your relapse plan in place. Like if you're going to go use again, what's that going to look like? Who would you call? You know, and obviously there's some education there about who you probably shouldn't be calling, but I mean, they're thinking about it anyway. And then to apply it to your context, moms are worried about what if I screw this up anyway? It's not like they're not having those thoughts. So let's just have fun with it. Put it out there. Okay, you're going to go to yoga. How terrible could that go? What is the worst case scenario? And then compare it to what actually happened, and it's usually a win. Where if you put out this perfect scenario and compare it to what actually happened, you feel like a loss because you're like, well, it wasn't perfect, so I feel bad now. But there's so many different degrees of success, you know, so many shades of gray in there, and finding ways to give yourself credit for that. Before we go on, I want to say a few words about Anew Behavioral Health. Anew Behavioral Health is an outpatient provider of mental health and substance abuse services in Ohio and New Hampshire. That means that Anew can successfully treat mental health and substance abuse issues or dual diagnosis if you're struggling with both. Their integrated approach allows for them to successfully address issues related to anxiety, depression, addiction, trauma, and really anything that stands between your life and the life you could be living. You really cannot bring them an issue that they have not successfully treated. They have also solved one of the biggest problems for people seeking help. They have a dedicated team waiting to hear from you at helpnow@anewbh.com. If you contact them today, within 24 hours, you will have heard back from, wait for this, a real live person, and will also have your first appointment scheduled at that time. So how do you contact them? Well, if you're in Ohio or New Hampshire, you're probably close to one of their local locations. You're welcome to go in. If not, you can always reach them online at anewbh.com. And if you're interested in services for you or loved one, use that address, helpnow@anewbh.com. You had mentioned, you said this a couple of times, it's a common phrase, baby blues. And there's some language around this of like, well, I don't want to scare anybody because we all go through this and it's going to be, So how does somebody identify when it's like baby blues or just part of the natural process? And when they've crossed that line to like, oh, I've got an issue here. I've got to do something, because we do see some horror stories where things go really wrong, right? And moms take, dramatic action. They don't care for the child or they don't care for themselves. They fall into like clinical depression. It becomes like a big problem. So what is your kind of diagnostic line between like just riding the ups and downs of early motherhood and, okay, we've got an issue that requires attention here?
Generally, like if you're really concerned for yourself or like you feel like this is just not normal or I'm concerned, I'd say reach out, like no matter what. Talk to your physician, talk to your partner, talk to your support systems, like let other people in on the loop, because as soon as like you're being secret about it or like you're feeling shameful, usually is what happens, right? That's just going to increase it. And then there's more issues that can happen from that, because either people don't know for such a long time, or, they're not knowing what to look out for. And they don't know they need to check in on you either, right? So I'd say if you're at all concerned, just start talking to people about that. Just start saying it out loud to even people. Baby blues generally really common. Essentially what it is just when your hormones, because of after labor, they're just trying to get back on a set system, and that can take some time. And so your emotions are all over the place, and it can kind of impact people a little bit differently, but essentially it is emotional dysregulation. You might feel sad. You might find, like me, you're just crying all the time, but you don't know why. You could feel really down. You can want to isolate from other people, those kinds of things. It usually sets in like kind of around day 2 or 3 after having your baby, and it'll last for about 2 weeks. If it starts to go beyond the 2 weeks, or you find it's really pervasive, if you find yourself thinking about how you are maybe trying to kind of separate yourself from your baby, and you're noticing that you're not feeling really connected, those can be the signs that maybe it's starting to go into, or maybe it has always been, postpartum depression, where it's this general low feeling, listlessness. It can be really sad, or it could just be low. You could be ostracizing yourself from other people. So a lot of the same symptoms. The main differentiating factor is kind of the timeline of it. And I think the other thing to recognize too is that you can get postpartum depression like while you're pregnant as well. That's actually really common. And especially if you have a history of having anxiety and or depression, you're more likely to experience it when you are pregnant and or during postpartum period. So just knowing that, I think, can be really great for women as they're planning, kind of doing their family planning as well, because maybe that then helps in just putting in some more of a protective structure around what do I need to amplify up in my support network in helping me while I'm pregnant, but then also a bit of a postpartum plan. Because the fact is, I don't know exactly what it is in the States, but, in Canada, we have quite a few doctor's appointments when we're pregnant. And then you see your doctor at 6 weeks, and that's kind of it, right?
That's it.
and they ask you, how are you feeling, right? And they do their general questions. And if you have a good doctor who's really invested, like they'll go a little bit deeper and they'll really like try to explore. But a lot of the time, also when you're getting to that appointment, like you're dealing with a newborn and like you don't really know what you're answering and all that stuff too. So if you can think about it ahead of time and just kind of prepare yourself for, here's the checklist of what I want to be on the lookout, share with your partner so they can know too. That can be really helpful in just getting early intervention and also preventing it from becoming more than what it needs to be.
No, you have a great point. And you're a really good doctor because you said that very friendly and you made great eye contact. Our experience was they're looking at a tablet and they're going like this. Any symptoms of depression? Are you sleeping? Medicine's okay? How's the baby sleeping? Okay, we'll see you in 12 weeks. I mean, I feel bad for doctors because it's such an assembly line that's been created, right? And so that's not a knock on doctors. That's a shot at the healthcare system as a whole. I mean, the way we set them up is so terrible. Every doctor I've ever talked to is like, I wish I had more time. I want to be able to connect. I want to be able to do a deep dive, but it's 4 p.m. and I've got 16 more appointments before the end of the day, and so everybody gets a touch.
It just becomes a thing. It's a little bit more onus on the patient too, right? Of like, if you know the medical system's set up that way, then like something I sometimes encourage clients to do is like, let's think about these different supports that you want either through pregnancy, but also your postpartum plan. So whether or not you're dealing with a midwife or an OB, like let's expand that a little bit. Do you potentially want to have a doula as a support person? Do you want to look into like a lactation consultant before? You may or may not need them because they're high in demand. Do you want to look into like pelvic floor physiotherapy? Because all of this, like these are all your people in your network and they are all checking in on you too. And they're helping you with different things, but it's just like putting all the pieces together, right? To kind of help it be a little bit more seamless. And then also it's not all eggs in one basket of if you go to your physician and they're so rushed and they're going through the checklist and, you leave and you realize, okay, maybe I should have said this. You've got other places where you can kind of start to rely on that support as well, but it's giving you more chances to also check in with yourself and how you're doing and what the reality is versus what you feel like you should be saying.
And I like the proactive nature of what you're saying. I was talking about this with another guest about, I wonder if expecting mothers shouldn't establish with a therapist anyway, even if they feel fine, because the wait is so long, right? So if you wait until you're in a postpartum situation, I don't know how it is in your area, but here, you could be waiting weeks, if not months, before you get in with a provider, right? And when you're in the midst of depression, you're in the midst of anxiety, months feels like a life sentence, And so I made the comment about maybe even prophylactic care, like, when you're 4 or 5 months pregnant, establish with a provider, get your weekly sessions going, or even, twice a month, so that when you need them, they're in place. And worst case scenario, you don't need them. So you say, I'm good. I'm going to transition out. But because I just think it's a desperate situation once you're in the midst of it and you're diminished, you're facing a challenge, you're not at your best. And oh, by the way, you've got to navigate this healthcare system and you've got to wait for months. And I don't know, I think it can be a very hopeless feeling, when you're stuck in that situation. So the more you can do ahead of time, I think is a great advice.
There's nothing worse than all of a sudden making that decision and not being able to access help, right? Because you feel hopeless. And then you're in this place of I really don't know what to do. So, meeting with a therapist who's actually trained in this area, who knows the questions to ask, even if you think things are fine, they're going to be poking you a little bit of okay, well, what supports do you have? What's your plan for getting sleep? When the baby is up all night, how can we maximize and prioritize your sleep? What about you need really good nutrition? You're going to have to be super hydrated. You're also going to be exhausted. So who can help with that? What is your partner going to be out of the house working, or are they going to be at the house? How much of a role do they have? What things do you normally do that you can offshore to other people or services for at least the beginning until you get a bit of a bearing, and then you can decide if you want to switch it up. But then also thinking about personally for yourself, people heal differently. mentally and physically. What's your current exercise level? Like, how important is that to you? How do we maybe flow with that when baby's here? How is your relationship? Here are some things you and your partner might want to talk about to help alleviate, bumps in the road. So you're going to have a professional that's going to get you thinking about things that maybe you weren't thinking about. And as you said, if you don't need them later down the road, great. But it's doing that proactive nature of helping you, your family, your unit, and then also giving you a place where you've already established a bit of a relationship so that if you're feeling you need more, it's a bit easier to access that too.
Well, and that's an important concept you're talking about too, about prep work with the healthcare system and understanding that you are at the center of this healthcare system, right? You are not being driven or guided by your healthcare professionals. They're working in a real sense for you and with you, right? And so there's this concept of concerted cultivation where there's research that shows that higher educated families, higher achieving families, they actually are working with their children to interact with the world in a peer-to-peer kind of relationship, not just in a passive type of situation. So when they're on their way to the doctor, they may say, what are some things you want the doctor to tell you about? What are you going to ask them about? They're preparing them to be an active participant in that conversation versus sitting there going, yes, sir, no, sir, fine, good. Or the doctor says, here's this medication, take it, instead of passively saying, great, being empowered to go, why are you recommending this? What is the diagnosis? What are the side effects? What can I expect? Are there any dangers for this, right? So being an active consumer and actively prepping, for the care you're going to receive is so key. Easy to say now while we're all emotionally regulated and feeling healthy. Tough to do after you've had the child and you're sleep deprived and you're feeling certain ways. So I think preparation is key. You have talked a lot about support networks and support systems. I feel a bond and a kinship with your husband because I've been that guy who's sitting there with a crying wife going what do you want? You know what I mean?
What do I
everybody just tell me what to do and I'll do it. Right. And all the jokes about running out in the midnight for ice cream and pickles and we will do anything we can. But I think guys need a roadmap. We're not really sure what that support looks like. So for partners and people in that support network, do you have any advice for what good support looks like, or what should people be thinking about in terms of preparation for that support? And in general, how can we support moms better?
So I think for the mom side, I think it's about getting the courage to actually ask for what you need and to not feel bad about it. And then at the very least, you're being as clear as you can be. And if what you need or what you're asking for is changing, that's completely fine. For the people around them, I think a lot of it is having those conversations with your partner about, I don't know all the stuff. Here's some things that maybe I'm concerned about. Or I'm thinking about how after I have the baby, I'm not really going to want to get up and even get myself, some fruit from the fridge. So I'm going to need you to prepare the food, and I'm going to need you to literally hand it to me and tell me to eat it, which is what happened to me. And so
right.
My husband was really good. I was monitoring the baby more so, especially those first couple of weeks. He was keeping me on my schedule. He was handing me water, keeping it filled. He was handing me food, would take the baby and said, eat. He would tell me, go take a bathroom break, real basic stuff, but you honestly don't think about it because you're just a little shell-shocked and you're delirious, right? So we need the people around us to be really clear and from a caring point of, hey, this is for you, take some time, actually get some nourishment and get some energy in you. I think the other thing too is just even talking to the people in your circle, whether you've got family in town or not, of how soon do you potentially want visitors and how much time do you maybe want it to just be your core 3, 4, however many is in your household. What can those people do to help support you if you don't want them to all of a sudden be in the house doing the visits, all that stuff? Maybe they're dropping off food. Maybe they're sending cleaning services. Maybe, you got to think about this stuff of what helps the household run generally. What are the general needs? What can you get rid of? And then what can you alleviate from your plate? And you might also just talk to your partner of I don't want to decide any of this. I want you to figure it out. And that's okay too. It's whatever you guys are comfortable with, but it really comes down to the mom trying as best as you can, because especially if you haven't done this before, thinking about what would be those things that you would normally do or have to think about in the day, and trying to get rid of as much of it as possible, because you really just want to focus on your sleep, your rest in healing. And for the first little bit, it's not a whole lot of exercise. Like, you're laying pretty low to help yourself heal as quickly as possible. And then also mentally, just to not have extra stuff and extra chatter in your brain, because you're trying to go off of cues of this thing that's a couple of days old, that's not really giving you a whole lot of feedback, right? So you've got enough to think about with that, and just being able to get as much off your plate as possible can be really good in trying to minimize what's going to kind of stress you out or just be too much.
I don't know how it is in Canada, but also too with a generally very limited maternity leave, paternity leave system, because a lot of this doesn't happen in a bubble. It happens with one partner back to work or very limited maternity leave. And I think that's a difficult transition too, when people are like, okay, now I've got to get outside caregivers involved because I'm going to go back to work and things like that. Kind of a tough question because everybody's situation is different, but a lot of this focus on support, the partner's role and things like that. Do you have any general advice, or do you have any general strategies for a more isolated parent, like a single parent or somebody who doesn't have the extended family support? What are some general tips, or how do you deal with that situation, knowing that support is so key? What do we do with those moms who don't have their tribe or are generally more isolated for various reasons? What can they do?
Tough for sure, right? Because it's hard enough as it is when you're in a partnership, and to be solo, like that's going to really bring up the feelings of I literally can't break, or I can't have a day off because there's no one to take over. And that's a lot of pressure there for sure. I think we got to do the best that we can, really. And I think it's about also for single parents to really acknowledge that you know you're doing everything that you can. So if you don't have family that's close by, like compared to the ones that are really fortunate to do so, let's look at what kind of social settings and networks have you been involved with prior to having children that can also like move over. So whether it's like your workplace or your contacts there that maybe are a little bit more than acquaintances and like friends, think about your friends that are close by, your neighbors that you help out, that have helped you out too. If you're involved, in a church or like any kind of community setting group like that, it's getting comfortable with reaching out to the people that you have in your network and not thinking that it needs to be a family member. It needs to be someone super close to me, because I think when you know the people, like when you've got a very good relationship with somebody, and if they've been through it before, especially, they're going to recognize you wouldn't ask if you didn't really need it. Right. And I think what I've realized too is that, when I hear, and I'm at the grocery store and like maybe there's a kid in a cart over that's kind of losing their mind, I'm no longer irritated. Like I might not want to listen to a kid crying, but I'm immediately looking at the parent and thinking, okay, is there something I can do to help them? Because I've been there. And the fact that somebody asks or says, hey, how would I push your cart? Like, what do you want me to get from this aisle for you? You just watch your kid. Like, what can I do? That means the world. That just makes, because they see that you care. They see that they're not just like being judged or like pushed to the side, right? So I think it's the sense of like really just looking for that community in those people that are decent human beings and, can help wherever they can. So if you don't have the direct family or the direct partnership, to understand and to also just acknowledge it's okay that maybe this person is part of a larger circle, or I'm going to my neighbor to ask them to come over for 20 minutes to just help me out. Well, if they're a good, decent person, like they're probably going to have no problem with that too. And to not stop ourselves from asking and just putting ourselves out there to really increase the community aspect of it too. The other thing is really like, there's always groups to join, and like, the virtual scene is quite large now too, especially after COVID. So if you're needing that space of even just talking to people that kind of get it so that you don't feel like you're on an island, I think that can be really helpful, later in the evening when you're not doing as much of the parenting stuff. of giving yourself some space to be around people that understand as much as they can, and to feel that sense of it's not just me, and it's okay that I'm having a hard time too, but there are people out here that get it, and they might not be able to do anything to, make it completely better, but just that validation can be such a huge piece.
I've got some serious, concerns about technology and the role in the human experience now. But one thing that I think that is a big positive is that ability to connect, right? So those online groups, and doesn't mean because you join a new moms group that, you're going to like everybody, but it's like a buffet, right? You kind of ignore and move through the ones that you don't really connect with, but maybe you find a friend miles away, that kind of thing. So
what if you find a really good friend?
What if you find a friend? Yep. I love it. I love the indirect. Like, what if you could, were you solution focused in your background? Cause you have like a lot of the solution focused language and how you approach that. Yeah.
I tend to be.
What if could be? Yeah. I can smell my own there. Cause I've used that a lot, and I think it's great. I think it's the most flexible modality there is. Okay. So kind of a 2-part question is going to have the same answer. So if you could go back now, knowing all that to before you had your first child, what would you have prepared yourself for? What would you have done differently? And at the same time, I'm asking, if somebody's listening to this right now and they are currently pregnant, right? What should they be doing, or what should they what benefit can they get from your experience and say, hey, I didn't know this then, but if I had to do it differently, if I had to do it over, this is what I would do differently to have a better experience?
Well, so I kind of lived it having my second child and just having a completely different experience, which was partly me and partly different kid, right? Yeah, they always throw you a curveball. I would say, going back, it would really be try not to get wrapped up in the traditional stuff of what you think you're supposed to be preparing for, and really look at, play out some of the worst case scenarios. And if this were to happen, what would make it easier? And then work back from that. And with, I think, the big umbrella around that being the support system of, let's talk to my people, professional and non, and we're all going to get on the same page of what's your responsibility in this. So if I get hit with baby blues, what's going to help me? If I'm finding it really hard to manage the day-to-day, what do I need? Who can help me? What's a plan my partner and I can put into place of dividing up the responsibilities? And when I'm having those hard days, how am I going to support myself? What are some things I can say to myself? Because I think a big piece of that is also reminding yourself, like, there are going to be moments that this is really, really hard. You're going to be pushed to your brink of what you never knew was possible, and you're going to survive it, is the other piece. And we usually ignore or get lost in the, and I'm going to survive it. We just don't consider it at all. And I think it's really important for my past self too, of if I knew that, it would just help me so much in the day-to-day moment of, okay, deep breath, I can get myself going. This is fine. It's a walk around the block. I'm going to manage it. I'm going to be okay. Let's just try to go out there, listen to what the sounds are, breathe in some fresh air, and when I get home, I'll take it from there. And if anything else, I think it's also, there's no perfect equation to any of this. It is really about gathering the information as you're going through it, and then taking those small steps forward that are leading more so in the direction that you want it to go. So I would also tell myself, past self, that I probably should have connected with a therapist before I gave birth, because even though I know it, it's completely different when you're talking to somebody, and to just help me in at the very least, making a temporary postpartum plan. And then you can get into it and you can see, maybe you're the mom that wants to get out of the house all the time. Maybe your life is pretty much the exact same as it was before. But at the very least, like, you're giving yourself options, and you're not ignoring you in the whole piece of this. Because really focusing on you is going to help your baby thrive even more, and it's going to help your relationships, and it's going to help everything. So really just focusing on any of those factors, I think it's so much better than not. Like, you're going to be steps ahead than if you were like me and just decided I'm going to put my head in the sand.
Yeah, no, we didn't do it perfect on this end either. And even with our second child, I wouldn't say we got close to perfect, but the kids are healthy, the kids are happy, and everything turned out okay. I think that's the key part of your message. Like, it's going to be okay. It really is. And if you're the type of parent who's sitting there going, am I doing this right? If you're that conscientious parent who's even considering your own performance and evaluating yourself, you're probably miles ahead of so many other parents who maybe aren't even giving it consideration, right? Like, if you're the type of person who's asking the question, am I doing it right? Then you're also the type of person who's probably going to do it pretty well naturally, right? Because you're trying to do a good job.
Exactly. And I think that's the other way to look at it. Like, if you're asking yourself these questions, or even if you're worrying because you care. And it's, and that's a great thing. It's when it starts to consume you, it's an issue. When it starts to impact other aspects of your life, that's the issue. But having these thoughts or worrying about it or asking these questions, you're doing that because you care and you just want to do what you can. And that's not a bad thing at all. That's a wonderful thing.
And knowing that there's two sides to the coin. I mean, what our family kind of phrase around this is that having children makes everything harder, but it also makes everything better, right? So if you take the example of like just getting out of the house with a child, it's much harder. You're not going to just grab your keys and walk out the door, right? You're going to pack a bag. You're going to get them cleaned up. It's going to take you a long time to get out of the house. But wherever you go, you're taking your child with you. You're adding to their experiences. They're going to see things for the first time. They're going to express wonder and joy to you, and they're going to ask you a million questions about why the sky is that color and why the bird sings the way it is, and it's going to refresh your appreciation of life, right? So that's worth an extra 20 minutes getting the car packed, So I think if you can remember that there's two sides to it. Yes, it's really, really hard. And yes, it's very difficult right now. But the payoff is that everything gets better. It just does on the longer timeline. So that's what kept us sane. And we do it again, right?
Yeah. And when you recognize it, it really helps out. Like, the mindset piece is huge. And what your kids can teach you is massive. And you don't realize it until you're really in it, or even after the fact. But looking at things from their eyes is a really great way of just slowing down and kind of checking your priorities too. Of this can be really great. Like, why is the sky blue? Or these questions that you never would have even fathomed. And you're like, yeah, that is pretty amazing. Something that was so simple to me that I never really thought of. And no, you're right. It is really amazing. And getting your mindset around this can be really challenging. It is harder, but it can be so much more amazing too. And you don't have to struggle through the whole thing. There can be really great pockets of wonderfulness around it.
And isn't that everything, right? Like, if you said yoga. So if you working out is hard, but the payoff is worth it, right? Advancing your career is hard, but the payoff is worth it. Relationships are hard, but the payoff is worth it, right? That's everything worthwhile in life has that difficult component to it, right? The easy stuff we grow bored of and we discard pretty quick, right? Something that somebody gives you for free gets put in a box and lost to time. Something you spent your money on, gets displayed on a shelf, right? That has value because there was a cost to it. And remembering that is so key. And the best evidence is we do it again, right? Like, you have more than one child. I have more than one child. If it was so terrible and insurmountable and soul crushing, we would only have one kid. But there are people walking around with multiple children. And I think that's the best evidence that it's worth doing, because people wouldn't sign up to do it again, otherwise. So.
And you learn from every experience too. I'm learning things now. I'll always be learning stuff. But I think there's a lot of value in the process too. And you can always teach, you can always help, you can always give that to others, from your own experience.
Just to kind of wrap up, I know we've got to be respectful of time. People don't realize, the whole human element to this. We're sneaking away from our real jobs to do this on lunch break. So there's a real appreciation for this time. What resources do you have? General resources, websites, groups, or whatever that you point people to when they're looking for support here? What do you use for educational materials or to inform, mothers?
So the main resource I really like is Postpartum International. So they offer connections to different therapists in your area. They've got online groups for moms and dads, all kinds of specifics in there. There's different resources. I find them to be a really, really great support system. Myself, like I offer my content through Instagram primarily. I do private practice clients. If you're located within Ontario or, elsewhere, we can kind of go into the coaching network that way. And then I've also, I've done a digital program for moms that are preparing for motherhood. So it's basically kind of your mental health blueprint of everything you need to know to prepare for that postpartum era. And I'm also working on some other pieces as well. But I found I wanted to pour my heart and soul kind of in this main program of right when you're getting started, what is the stuff that you really need to know that you can do on your own time and kind of take it in small snippets so it's not overwhelming. And if for nothing else, it just asks you some different questions that maybe you haven't considered and gets you thinking about some different things. So then you are steps ahead of where you maybe would have been beforehand. So you don't have to enter in with, fear or doubt or any of those feelings. You can kind of go into motherhood feeling more confident, feeling self-assured, feeling good with the plan you've put together, which I think is such a key piece for moms, just prioritizing their mental health.
No, I agree. And that confidence, that mindset, you've touched on it a couple of times. But if you have that, I will survive, I can do this. Whatever contributes to your plan that makes you feel more confident, which will then feed competence and vice versa, I think is amazing and so key. So yeah, what an amazing journey that you've gotten into this specialized. Just to wrap up, my own curiosity, this has nothing to do with the show, but who were you working with before you made the switch? Like, what was your population and who were you offering therapy? Was it pretty much open or was there a specialty before this?
So I was working with university students. Yeah, primarily. So I would see the gamut of like all kinds of issues in very different population.
Yeah, older babies, right? You've got No, but it is life transitions, right? Two very key life transitions, entering the world and then finding your way into adulthood. So that's amazing.
Yeah.
So Marissa, thank you so much for this time. It was amazing, very educational for me. All of your links that you had shared, we will absolutely put in the show notes below. Ian's been over there taking copious notes, so we'll provide all your links. But just thank you so much. Like I said at the beginning, everybody has a mom. We want to support our moms better. And I've learned a lot through this because, like I said, I've been doing this for almost 20 years. I never was really even aware of the maternal support specific aspect of the field, right? I certainly had seen moms, but not in that context. So it's amazing to learn that niche work, right, and that specialty work, and it's obviously very needed. So thank you so much for your efforts in the field. You're helping moms and you're helping babies. How could there be a higher calling than that? It's amazing. So thank you.
Thank you so much. Yeah, it's a pretty great one to have.
Yeah, and you're smiling a lot. You can tell you enjoy your work and are very passionate about it. So that's it's nice to do something that's fulfilling for you personally as well. So,
oh, absolutely.
Good. So, and I always at the end want to give a shout out to our sponsors. So, when Marissa was talking about that line between baby blues and into postpartum and diagnosable, so the maternal and the mother specific, you have to find a specialist like Marissa to help you through that. But if you're dealing with those feelings of depression, you feel like you've crossed over that line and needing more help and more support. If you're in Ohio, you're in New Hampshire, Anew Behavioral Health has psychiatrists, therapists, nurses, case managers ready to help you with that. They put an integrated plan, which means they combine multiple services. Marissa talked a lot about a network of support. Anew can provide that for you. And if you need to reach out to them, you can find them at anewbh.com. Or if you need help more immediately, help now at anewbh.com. We'll get you there. Final round of thanks to Marissa. Thanks to producer Ian. You guys can tell because of how smooth this went that Ian was at the controls, so we were in good hands. And a final thanks to you listening, watching, however you're receiving this information. Time is your most valuable asset. We appreciate you sharing some of that with us, and we hope it was worth it. With that, we'll wrap it up. So thank you again. And until next time, take care of yourself, take care of your mom, and take care of each other. Thanks so much. Hey guys, although Through Help and Back is an excellent podcast with a lot of great ideas, I do want to let you know that in no way is Through Help and Back expected to be perceived as or relied upon in any way as specific medical advice or mental health advice for you personally. The information provided through Help and Back on our website or our podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment that can be provided by your own providers. Do not use our content in lieu of professional advice given by qualified medical professionals, and do not disregard professional medical advice or delay seeking professional advice because of the information you have read on our website, heard on our podcast, or otherwise received from us. Although we love discussing issues related to healthcare, mental health, and addiction, we are not providing direct healthcare, mental health care, medical, or nutrition therapy services. We're not attempting to diagnose, treat, prevent, or cure in any manner whatsoever any physical or psychological ailment, any mental or emotional issue, disease, or condition. We are not giving you specific medical, psychological, or religious advice whatsoever. Please take care of yourself and take care of others as you always seek the advice of your own medical providers and your own mental health providers regarding any questions or concerns you have about your specific health, or before implementing any recommendations or suggestions from us. These are ideas that have worked for other people. We think it's important to share them. We do not guarantee that they will work for you specifically. Do not stop taking any medications without speaking to your physician, nurse practitioner, physician assistant, mental health provider, or any other healthcare or medical professional. And if you have or suspect that you have a medical or mental health issue, contact your own healthcare provider promptly. Also, one last thing, if you know or suspect that you are currently experiencing a crisis, it is absolutely imperative that you seek the advice of your doctor or other emergency healthcare services prior to ever thinking about using our content. We love the conversations. We're glad you're stopping by. We hope you take a lot from the content. But again, for your specific individual medical situation, please always seek quality personal care from your own providers. Do not let this information or this advice stand on its own. Thanks so much for listening.